I'd like to find another weak point in cancer, something that will turn the table, if you want. This is what we need to do with cancer. We need to turn the table. Having incremental progress is important, but the dream will be to turn the table and make cancer a disease of the past.
I went to my doctor and he said, I'll send you to a urologist in Newcastle. And he said, there's cancer in there. We've got to put you in the Newcastle hospital and do a TURP, a TURP. They did what they had to do, and he said that you might never have to have anything else done. And it went out of my mind altogether. I never worried about it at all. And then, it came back. He was as white as a sheet of paper because he didn't know how to tell me that the cancer had moved out of where it was into my bladder and so on.
Patients may die of those forms of prostate cancer, and they need to be actively treated. So surgery is the main option. Then you have hormone therapy, eventually chemotherapy for prostate cancer.
I said, what's that mean? He said, well, it could mean you haven't got that long. He said, but there's this treatment out now, hormone treatment, plus radiotherapy. And he put me through 38 times with the radiotherapy and put me on Zolocos. And my reading went down to 0.0000.
Now, if we would be able to precisely know at the time of diagnosis which tumor is aggressive and which tumor is not aggressive, then we could select the patients for aggressive treatments, interventional treatments, and leave the other ones without treatment. And one way to do that, and this is what we are exploring in our lab, one way to do that is to look for nerves in the tumor microenvironment.
This year, I had got a pain in my hip and that. I went to the local doctor here and they sent me just for an x-ray, and the x-ray showed that the cancer had metastasized. I'm getting an injection once every 3 months called Leukerin and alpha-lupamide tablets. They've got a lot of side effects, but they're keeping me going. So,
drug repurposing in the context of what we do in my lab is that we take drugs that normally targets neurons, like the drugs used in psychiatric disease or cardiovascular disease, anxiety, that sort of things, and we test them on cancer cells. And we find that in our lab, but this is also found in other places, is that indeed they reduce cancer cell growth. If we could replace the aggressive treatments with less aggressive treatments, like by repurposing drugs that would have much less side effect, that would be really fantastic.
If I wouldn't have had any treatment back in 1995, I probably wouldn't have seen 1995 or 1996 right out. It's only the treatment that's kept me going, and the treatments obviously come from research.
My passion was about regeneration. If you prevent the nervous system to invade a tissue, it doesn't regenerate anymore. In the cancer field, this was ignored. So nobody thought that the nervous system could stimulate cancer growth. There is a missing piece of the puzzle here, so something needs to be done.
Everything in the world seems to get quicker, and I think research will get quicker. It's a puzzle. Cancer's a puzzle, and they've put a lot of the puzzle together, and one day the last little bit will go in, and you probably only need a tablet. If you get a cancer, you might only need a tablet or an injection, and it could keep you going for years and years and years. And that's the only way you're going to get that is research.